So we are going to talk about the Meso-Depressive disorder. Let me tell the description first. So Meso-Depressive disorder, it is a condition marked by persistently low mood, lack of energy, and absence of pleasure. So depression affects the feelings, affect the thoughts and behavior. It can occur after loss, including loss of self-esteem, the end of significant relationship, or death of loved one, or a traumatic events. The loss is followed by the grief and mourning. If this proceeds does not resolve, depression result. Depression may be mild, may be moderate, or severe. The treatment include counseling, antidepressant medication, and electroconvulsion therapy, shortly called ECT. So next we are going to talk mild depression. So mild depression is triggered by external events or follow the normal grief reaction. So if before to go to read this page, I want to tell one more point. Who is undergo to the depression, or what are the risk factor? The risk factor is loss of self-esteem, or end of the significant relationship, or death of loved one, or any kind of traumatic events. But sometimes depression or depressive disorder carry out from the family, means genetics or personal or family history of depression. Serious medical condition can cause depression. Neurotransmitter or neuroendocrine abnormality can lead to depression. Even sometimes depression is most common in female sex or unmarried person. You have to know. So we are going to discuss the mild, moderate, and severe or Meso-Depressive disorder. But if I ask you, what are the common sign symptoms of Meso-Depressive disorder? Maybe lack of energy, or poor concentration, persistent sad mood, appetite or weight loss, or suicidal thoughts, sleep disturbance, feelings of worthlessness, eudaimonia, moving or talking more slow, difficult with delusion thoughts. So all of these are the sign and symptom of Meso-Depressive disorder. But now we are going to categorize in three type of depression. One is mild form. They said mild depression lasts less than 2 weeks. Feeling sad, feeling let down or disappointed, mild alterations in sleep pattern, feeling of less alert, irritabilities, or increase or decrease appetite, increased use of alcohol or drugs. In case of moderate depression, depression persists over time. The person experiences a sense of change and often look for help. Despondent and gloomy, or dejected, low self-esteem, helplessness, powerlessness, may experience intense anxiety and anger. Also, the person may feel better at the certain time of the day, slow thought process, and difficult in concentrating. In case of moderate depression, we can say persistent thinking about and discuss of particular object or subject. Negative thinking and suicidal thought is common, sleep disturbance, social withdrawal. So they like to withdraw, isolated themselves. Anorexia, weight loss, and fatigue is most common. Somatic complaint. In case of female, menstrual change, increased use of alcohol and drugs. In case of Meso-Depressive disorder, we can say intense or pervasive. Also, despair or hopelessness, feeling guilty and worthlessness, flat affect, may show agitation and peace about, poor posture, and decrease the speech or slow speech, slow movement, self-destructive thoughts, socially withdraw, poor concentration, also severe psychomotor retardation, anorexia, constipation because patients do not eat well, urinary retention, hygiene does not maintain well, or lack of sexual interest, terminal insomnia, right? And also delusion and hallucination, abnormal belief, abnormal stimuli or perception. For a here I want to tell you, for client, the risks for self-harm, ask the client directly, have you thought of hunting yourself? This means patient has a Meso-Depressive disorder. Here I want to clear something. The alternative diagnosis of Meso-Depressive disorder, one is persistent depressive disorder, premenstrual dysphonic disorder, and seasonal affective disorder. So the person who have persistent depressive disorder, so chronically depressed mood that lasts more than 2 years and less severe symptom than Meso-Depressive disorder. This is persistent depressive disorder. Premenstrual dysphonic disorder, it is severe depression and irritabilities in the week or 2 before menstruation. Some female feel it. And seasonal affective disorder, it is depression during winter month and associated with decrease the sunlight. If you stay in the north side in America, sometimes we can see this type of patient because most of the time snowfall or no sun in the sky. I said it is associated with decrease the sunlight. So now let me go. What are the nursing intervention if my patient have it, or what are the treatment option, right? So first of all, nursing intervention, I want to tell you. Risks of harm. Assess for homicidal and suicidal ideation. So we have to assess for thoughts, risk factor for self-harm and suicide in all patients with depression. Implement one-to-one observation for the patient at the risk for suicide. Provide safety from suicide action. Be certain that there are no harmful objects in the environment. Do not leave the client alone for extended period. If the client has a suicidal plan, place one-to-one supervision. Form a no suicidal contact with the client as appropriate. So, but we do not assign private room and place the patient in a room close to the nurse station and make the frequent round at irregular interval. We closely monitor patient during the medication administration due to the risks of patient discarding medication or serving up to overdose. We encourage the sharing of feelings with therapeutic communication, focus on strength, teach the assertiveness. Let me read it. What are the other activities? We use gentle encouragement to correct participating in activity of daily living and until therapies. Do not push the decision making or making of complex choice or decision that the client is not ready for. We provide achievable activity in which the client can achieve the success. Also begin the client with one-to-one activities. Provide activities for easy mastery to increase the self-esteem and help in alleviating guilty feelings. Activity that do not require great deals of concentrations. Encourage the client to gross motor activity and eventually brings the client into small group activities and then into the large group. So what is the summary of the management, right? Sometimes depressive patient talk therapy very effective. Before to go pharmacological therapy, we better to go for talk therapy. If you ask me about the pharmacological therapy, we used to give them SSRI, SNRI, TCA, or MAO inhibitor. So atypical antidepressant can work. For individual with the severe and persistent Meso-Depressive disorder with psychosis, it's good to use pharmacological management. So next is you have to focus on nutrition, hygiene care, and sleep pattern. So nutrition means monitor nutritional intake and weight. Often we offer small, high calorie, high protein snack and fluid throughout the day. Stay with the client during the food. Hygiene care, monitor the general hygiene and self-care deficit. Deficit may indicate worsening depression. Assist with activity of daily living. In case of sleep pattern, monitor sleep pattern, decrease environmental stimuli at bedtime, and spend time with client before bedtime. So next, go here. What are the altered thought process? So remind the client of time when he or she felt better, was successful. Spend time with the client to convey the client worth and values. Encourage the client to discuss losses or change in life situation. encourage the client to express sadness, anger, and allow adequate time for verbal response and response to anger therapeutically. This is enough about the major depressive disorder.